All live.
Right, thank you very much. Good afternoon, everybody. Welcome to today's meeting of the Adults and Communities Overview and Scrutiny Committee. As usual, this meeting is being broadcast live via the County Council's website and will also be available for viewing after the meeting. Due to the current situation, all members of the committee and officers presenting today are joining online. Can I please ask that all officers and members mute their microphones until they wish or are invited to speak? And if you're able to use your video camera, to please turn that on for the duration of the meeting. If members or officers wish to speak, please ensure you use the raise hand function and not the chat facility. Before we begin, I will now ask members to introduce themselves. I understand that there are no substitutes today. I'll go first. So Terry Richardson, member for Whetstone and Narborough, chairman of the committee. If I can go to Dan Harrison.
Yes, good afternoon, Chairman. Thank you. Here and present representing Ibstop and Appleby. Thank you.
All right, Mrs. Broadley.
Hello, I'm Linda Broadley, representing Wigston North.
Thank you, Linda. Mr. Crooks.
Afternoon, Chairman. Bill Crooks, representing Mallory Division.
Thank you. Mr. Gillard.
Thank you, Chairman. Tony Gillard, representing the Whittick Division.
Thank you. Mr. Mear. Mr. Mear joined us. Doesn't appear to have signed in at the moment.
Not at the moment, no.
No, right. Mr. Poland.
Hello, everyone. James Poland, Syston Foss Division.
Thank you. Mrs. Amanda Wright. We got Amanda? No, I can't see she signed in either. So Mrs. Maggie Wright.
Hello, Maggie Wright, the Stony Stanton and Croft Division.
Right, so I think that's all the introduction, and we have Mrs. Amanda Wright and Mr. Joel Mear not present at the moment. So we'll now move on to agenda item 1, minutes of the meeting held on the 7th of September 2020. I propose that the minutes of the meeting held on the 7th of September are taken as read, confirmed and signed. Is everybody in agreement?
Yeah, agreed.
Yeah. Any not agreed? Right, excellent. Agenda item 2, question time. I have received no questions from members of the public. Agenda item 3, questions asked by members under Standing Order 7.3 and 7.5. I've received no questions from members. Agenda item 4, to advise of any other items which the chairman has decided to take as urgent elsewhere on the agenda. I have not been notified of any urgent items. Agenda item 5, declarations of interest in respect of items on the agenda. Mr. Harrison.
Thank you, Chairman. I'd like to declare my wife is in receipt of support and help from the council with her dementia. Thank you.
Right, thank you. And I think as a matter of record, anyone who's a member of a district authority also has that noted centrally. So thank you for that. Any other declaration of interest? Right, thank you. Declarations of the party whip in accordance with overview and the scrutiny procedure rule 16. I don't believe there's any declarations from the whips. Agenda item 7, presentation of petitions under Standing Order 35. No petitions have been received. Before we move on to consider the substantive items on the agenda today, as a reminder, can I ask members to allow officers to present their full report before seeking to ask questions. As we're all joining online, to ensure everyone has an opportunity to speak, I propose once the officers have finished presenting the item, I will then open up for questions. To indicate that you have a question, please use the hand raise option and I will call you one at a time. And sorry if I get the order wrong, but all I can see is yellow hands and not when they put them up. So can I just ask anyone who's not got their mic muted to do so? I think Councillor Harrison. And then we will move on with the first item on the agenda, which is the Adult Social Care Target Operating Model, which is set out on pages 13 to 40 of the agenda pack. There's going to be a PowerPoint presentation, which is in the hands of Heather Pick, the Assistant Director in the department, and she will then give a presentation jointly afterwards with John Wilson, who's the Director. So if I could call on Heather to take over and do clever things with slides.
Hopefully I'm sharing my screen. If you can indicate that I am or not.
I've got nothing at my end.
I have on mine. It's up on mine.
Yeah, I have as well.
So it may only be me.
Yes, I've got it as well.
Right. So I've got it on mod. I'll just manage without it, Heather, rather than if everybody else can see it but not me. Just carry on and we'll see what happens.
Okay, thank you. So thank you for inviting me to share with you the closure report for the Adult Social Care Target Operating Model, fondly called throughout the programme the TOM. You have a full report in front of you. I wanted to share the slides that we've got in front of us just to run through some of the journey and the achievements of the TOM. So in summary, the programme has delivered the anticipated benefits of 11.8 million recurrent annualised benefit through improved outcomes for service users and better staff ways of working. And I have to say at this point that it has been a journey and a big culture change for our staff group, but the benefits to our service users and the benefits to staff of the robustness of the programme has meant a great deal to us. In addition, we have delivered the savings, but the service user improvements have been key. So in the beginning, we looked at how we could make the best use of the available resources to keep people in Leicestershire independent. And we looked at enablement and making people's lives much more independent. We looked at collaboration, re-enablement, decision making, and we looked at delivering the best settings of care we can to make sure people have the opportunity to reach the independence for themselves. In the diagnostic, which was the initial opportunities that were identified through the diagnostic, we looked at increasing practitioner time, face-to-face time with our workers. We looked at the reviews. We looked at how long it was taking us to resolve contacts from people who were asking for our support. We looked at working age adults in supported living and how they could be more independent, either within the same setting or in a different setting. We looked at the opportunity for re-enablement, and we've had a very successful re-enablement service for a long while, but it needed to be improved to be able to receive the amount of people we wanted to get through re-enablement as a maximum. And we wanted to increase that to make sure that we were able to offer everybody who needed re-enablement our in-house offer. We wanted people in our mental health services to be confident that we were working with them towards recovery. We wanted to iron out some of the inconsistencies, in the commissioning of care packages across the county. And we wanted older adults in residential care to be in the best setting for them. And we found that meant that some people in our residential care settings didn't need to be there and indeed didn't want to be there. This slide provides an overview of the programme. So we've just been through the diagnostic. We had a very small window of setup period to get all our resources in place. We then had a design period where we tried and tested some of the solutions that we thought we could put in place to make sure that they were working and that they were giving us the best outcomes. And then we've had an implement and sustain period with measurement and governance to make sure that what we'd put in place was sustainable and robust and that we could continue it throughout the programme and beyond the programme for the next 2 to 3 years, delivering the benefits that we wanted it to deliver. The next slide is around the opportunity matrix and what we've designed from better outcomes from the people that we're working with. I won't go through all of the detail of the monies, but you can see that by improving outcomes for our service users, we are anticipating that we can also make some financial benefits and spend our money wisely going forward. And we've covered that off in all of the work streams, older adults and working age adults, and tried to tie in the financial benefits with the service improvements that we've seen across our service delivery throughout the TOM. This next slide, the blue line shows you the TOM targets for our benefits and cashable savings, non-cashable and cashable. The yellow line, I'm afraid we can't get through any reports, can we, without looking at COVID and how that's impacted. And we were very conscious of the fact that quite a lot of our guidance and our pathways had to change to react to COVID. So we've seen some service closures, we've seen differences in how we deal with hospital discharge, etc. And we've also seen a significant impact on the cost of services. I have to say that the yellow line shows you that it has been quite a journey, but that we are almost back to the blue line, which was the TOM line that we were wanting to achieve, and we continue on that line towards that. So that's credit really to the people who've been working in the programme and all of our staff who have been making sure that the impact of COVID is as minimal as it can be and that we've recovered where we needed to. We were measuring non-financial benefits. They're tricky to measure, and it's not been an easy measurement to have in the TOM. But you can see then we've seen significant improvements. We've seen 17% reduction in our permanent residential admissions. We've seen significant reductions in waits and the length of time people wait. We've seen a 48% increase on people in working age adult disabilities, so that's learning disabilities and physical disabilities, on track to achieve their ideal outcomes. And in mental health, we've seen a 65% increase on those people on recovery plans achieving their outcomes. We've had a slight delay in our annual reviews completed, and that's because most of the review teams in adult social care were redeployed into critical services, so hospital discharge and other areas of COVID impact, but they again are back now on track, and the redeployments have been reversed, so we hope to see that recover in line with the other indicators. Absence rates, we have seen very few COVID related absences, and that I think has been credit to managers and staff who are dedicated to their jobs and who have kept themselves safe in order to keep working. And we've had a huge increase in the use of our Tableau dashboards and data, which means we're very able now to see quickly where trends are going the wrong way and what actions we need to take. And we're very evidence-based in our service delivery. I've included 3 case studies here. You may have seen them before. We've collected them as we've gone along, but a re-enablement case study from Arthur, and again, how successful his re-enablement period has been since we've introduced the TOM ways of working into our re-enablement service. We've seen an older adults case study, again, just how important it is that people do, talk to and include service users in their support plans and recovery, and actually find out what's important in their lives. And then we've got Sophie, who demonstrates our 60 moves from residential care into supported living and other more independent living, and just how happy she has been with the Tom involvement moving her on. The next slide is capturing really a session that we had towards the end of the implementation of our programme with managers of our service, just telling you how important they feel the Tom has been and what a change it has been to them and their management styles, and how it has helped them focus, particularly through the COVID period, but giving them the tools to carry on implementing the Tom as a business as usual model rather than a project or a pilot. And I think that's something that's been very different with the target operating model, that we've involved staff and managers in this, and we've devised this as a business as usual model, not something that's a project or a pilot that starts and ends, but something that is sustainable and can continue for us for the foreseeable future. We also, for governance, had 2 internal audit reports, one midway and one more recently at the end of our implementation, just to look at the programme itself, the governance, the measures and the KPIs and targets that we'd introduced, to see whether they were robust and whether the programme had the sustainability to continue. And I am very pleased to say that both reports have reported a substantial assurance of the programme's delivery going forward. That is the end of the slideshow, so I will stop sharing if that's okay, and pause for any questions, Chair. Have we seemed to lost sound?
No, thank you, Heather. My mic was playing up. That's,
Thank you.
probably explains why I never got the slides. Right, thank you for that, Heather. I don't know if you've got your camera you can put on, have you? Or
Yes, I have. Sorry. I tend not to have it on when we have slides because it distracts, but yes, very happy to put it on.
Right. Thank you for that. Before I go to people for questions, I noticed Mr. Meir has been able to join us. I think he's had technical problems because he's dropped in and out a couple of times. I just wondered if you'd introduce yourself, Joel, just so that members know you're on the public know you're on the call.
Thank you, Chair. Sorry, I'm having technical issues with the Wi-Fi today, but yes, Mr. Meir here. Thank you.
Right, thank you, Joel. Right, so the first question is with Dan Harrison.
Right, thank you. Chairman, it's more of an observation because I'm relatively quite new to this committee. I have made the odd visit from time to time in the past, and I just want to say how absolutely I was amazed but delighted to read this agenda item, because really when you think that the efficiency, making things better for people, has actually helped reduce our costs at the levels that you have. And I'm just absolutely thinking, well, you know, my congratulations to you, Heather, and to John and all the team, because this is really, really out right there at the front of all of this. This is fantastic. Well done. Thank you very much.
Thank you, Dan. Do I have any other speakers? I see no other hands are raised. I think you've obviously killed them with the PowerPoint. I missed, Heather.
Mr. Chairman, sorry, I had some questions. Sorry.
All right. Can you use the hands up facility, Joel, if you can, or is it not working at your end?
I think I have.
Oh, it's just literally come up. Please, please come in.
Yeah.
Sorry.
Okay, thank you. I just had a question regarding the cost of it. In the papers that we've got, it says £4.5 million was the fee that we've paid Newton. Can I ask if that is going to be the total cost, or is there more cost on there? And then I had a general observation on the target operating model. But if I can have an answer to that, I'll come back on the other one. Thank you.
Do you want me to take that, John?
Yes, by all means, yeah.
Okay, so that was the fee for the consultant support in the programme. My understanding is that the more savings we make, there is a small cut for the consultancy going forward.
Okay, thank you for that one. But then on the actual target operating model itself, just as a general observation, we're making substantial savings, but if we're making substantial savings, it isn't always the case that the service is better. And I thought, is there a comparison that I can use? So the comparisons that I could use is potentially, if you think about it, we're looking at a final salary pension scheme and then a money purchase scheme. So is it what we had was a final salary pension scheme, gold-plated pension scheme, and what is it we've now is a money purchase scheme, if you think, if I can use that analogy. Is that correct? Because are we giving less but dressing it up as more?
So I'm not familiar with the pension schemes, but what I would say is I think what we were doing was. So I'll give you the comparison of residential care. Residential care is our most costly support package. It costs the council quite a lot of money. It costs people in contributions a lot of money. When we looked at our diagnostic, 30% of people didn't need to be in residential care and probably wouldn't have chosen to be there, but for their circumstances. Usually that's because they've had a crisis and they've had no choice but gone into residential care. Had they had more time to think about it, and had they had more time, more support available in their own homes, they would have gone home. They would have had a better life. They would have been able to live in their own home with support and have their own family and things around them. But circumstances had overtaken them. What we've done here is made a conscious decision to support people to return home and to invest in those services that would let them do that. Those services are cheaper. Now, that's by the by. The right thing to do is to support people to go home and have an independent life. For the council, that happens to be cheaper. So that's the way forward we wanted to go. And we could mirror that in people with learning disabilities in residential care, etc. Actually, the right thing for them is to be supported more independently. To support people more independently in the long run, then is cheaper.
Thank you, Heather. I think John wants to come in at this point, Joel.
Yeah, that's fine. Then I have a bit of a follow-up after that. Thanks.
Yeah, thanks, Chair. Yeah, I'll just reiterate that point that Heather's just made, really. The whole purpose of the programme was to improve outcomes for people using services. And we always thought that if we could provide the right care at the right time, in the right place, first time, it would improve people's outcomes. So people wait less time to have their referral received, people have less time for their assessment, people have a more timely service, people have the right service, so that their independence is maintained for longer. What that means is that the council spends less, if you like, on providing care for people. But actually, that's a good thing, because most people don't want to have to rely on care. Most people want to be independent. So, yes, we've been productive. We've become more efficient. We're not perhaps spending the same amount that we did previously on delivering care for people, but that's only because people are more independent. So another example, great example, is Re-Enablement, which is our biggest area of financial saving. The way we've done that is to ensure that we re-able more people. So more people have the opportunity to become more independent. We re-able more people because we've made that whole process more efficient. We can re-able people in 2/3 of the time that it used to take us. That means that we can bring 1/3 more people through that process. The added advantage of that is that it means that because people are requiring a lower level of care at the end of that re-enablement period, there is more care, therefore, to go around for everybody else. So we've saved hours of care from domiciliary care agencies. And because we've saved some of that care, that's meant that when we hit the COVID pandemic, And we were very worried at the start in March and April that we wouldn't have enough domiciliary care to go around. Actually, we have had, and part of the reason for that is because we created capacity within the sector by re-enabling more people. So I suppose I'm not sure about whether it's a final salary pension scheme, but what I would say is that at the heart of this is about making sure that people are more independent, more able to care for themselves, less reliant on the local authority.
Thank you for that, John. Councillor Mear, you want to come back?
Thank you, Chair. I just had an observation really, because everything that Heather said and John's followed up is something that isn't something that we would have expected anyway. Talking about getting people out, not into care homes but in their own homes, living there, that would be something that we thought would be done as standard. Does it really need a consultant, and for us to pay the consultant £4.5 million? Did it need us to have that wow moment? I didn't think it really did. I don't think there was anything that Heather said in the presentation or anything that Heather said to the answer to my original question that thought, actually, no, I hadn't thought of that, and that's why we're paying them. I think, that's the query, really. But I'll take that as an observation and a statement for myself, Chair. Thank you.
Right, so I'll bring in I'm sorry about your cynical approach there, Joel. I mean, sometimes we do need other people to come and help us improve and save things. I think sometimes the word consultant gets a bad name, but if they achieve better results for our residents and better results for us, I don't see what's wrong with that personally. But over to the portfolio holder, Richard Blunt.
Thank you, Chairman. Thank you to Dan Harrison for it. He's definitely a man with a glass half full, and what he said is exactly what I planned to say. So thank you for that, Dan. Mr. Mear, I'm sorry, you are a man with a glass half empty. We're improving outcomes, which is what we set out to do. We said that before at the beginning of this process, and you supported it. It is a virtuous circle. I've said it so many times. If we can intervene in a timely way and give better outcomes, then that is what we need to do. We do things quicker and better outcomes. When we first approved this, we said it'd be £5 million circa fees, but they'd only get paid if they delivered over 5 million of savings. So we were in a relatively good position. If they did nothing, we got nothing out of it. So I really wish Mr. Mear would fill his glass up and salute this scheme. Thank you, Chairman.
Thank you, Richard. Mr. Crooks.
Thank you, Chairman. I'm not quite sure whether I'm asking this question in the right place, but Heather touched on it. People coming out of hospital into care homes. I had an email from Councillor David Bill this week, who's concerned that some people had been sent into care homes in the Hinckley area that hadn't got any package in place or protection or whatever. Not 100% sure, and I probably need to find out more, but I just wondered whether the director got any comments on that.
I'm not sure that falls within the parameters of this report, but I don't know if either the directors want to take it or if it's something perhaps I think might be better for David Bill to come in directly with the actual cases so they can be looked at. I think it would be unfair of officers to comment on something where we got so little information. So I think if the officers are happy to look into an email coming in from Councillor Bill, would that suit everybody?
Definitely, yes.
Mr. Crooks? Are you happy with that? Thank you.
Thank you, Chair. I'll pass it on to Councillor Bill.
Thank you. Now we have Christine Radford.
Thank you, Chairman. Just going on following what Richard said, I'm his support, that I've been more involved with the supported living and of course as county we're building extra facilities, and when I've spoken to the people that have moved into them, they think it's absolutely brilliant. They are so glad to get out of the care home mentality, and they've now got their own front door. They can do their own things, they can go shopping, they can have friends round. I'm not saying to have a knees up, and they haven't been able to during COVID, but they're independent. They are living lives as younger people, can live their lives. So we really have improved them. And I know as a council, we are looking at doing more of this. And as I say, I've been involved before the spade's been in, and half of them are built, and I shall get there when they finish building them.
Thank you, Christine. Linda Broadley.
Thank you, Chair. I actually think it's a brilliant report. The consultants' fees, unfortunately, like most councils, we do have to get consultants in because we're not experts on everything. But it is a good report. What Mrs. Radford said, I used to work in learning disabilities. When we first started putting people into supported living, it was a bit here and there, because I do feel that some people went into supported living that didn't really qualify for supported living. There's no way they could. Things have massively improved over the years, and I think certainly for adults with learning disabilities, it's been brilliant. The concerns that I have, obviously, is that this is ongoing. I would like to think that we've come so far down this path that we're going to continue with this, continue not only to make savings but to improve people's lives. But as far as we've got, it's been very welcome. Thank you.
Thank you, Mr. Broadley. Mr. Meir, is that your hand? Is that an old hand or is it a new hand?
I think that might be the old.
Right.
That might be the older hand. I'll lower it now. Sorry, apologies.
Right, thank you. So I think I've gone through all the speakers. I'd just like to echo the point that's been made and Dan made. I've had the privilege to be chairman of this committee since the inception of the target operating model process, and I'd echo what's been said. This was never about saving money. This was about improving outcomes. As a byproduct, we've saved money, which I think is for the benefit of the council, in that it can use that money in other services. But it is clear from the reports we've had throughout that the outcomes for residents have been better, and that's something I think we should all be proud of, and I hope Councillor Meir can bring himself to feel proud of it. Yes, there was a cost associated, but it was a sensible contract negotiated by the council that said if we didn't make any benefits, there was no fee payable, which I think is the right way around. So I would endorse what's being said. I think this is an excellent report. I think it's been excellent the way this committee has been kept up to date with the progress. And I would ask certainly our officers to pass on our thanks to all those involved in making this happen, and hopefully the movement of the process into other areas of the council will benefit other services as much as it has this one. So if Heather and John, you could pass on our thanks to all those involved, particularly those at the coalface, if I may use that expression, who've done the hard yards, and thank them for everything they've done. We'll now move on to agenda item number 9, which is the care home sustainability, which is set out on pages 41 to 98. And I'm not sure whether it's John or Sandy, but I'm sure one of them will leap in and take over.
I'm happy to introduce it and then pass over to Sandy, if that's okay, Chair. So this is a report that was requested by members of the committee to give some information about the current market for residential care, and particularly in the context of the COVID pandemic. The report outlines some of the issues that we face with residential care, and also highlights some of the risks that are present currently. It's worth just noting that the government asked for each local authority to complete a self-assessment on the risks to the care market over the next 6 months, and we've included that within this report. Unfortunately, we had to submit that ahead of committee. The timescales didn't allow us to bring it to committee ahead of submission, but the information is contained within this report. So I'll hand over to Sandy, if that's okay, and to take you through the report, the main areas of the report.
Thank you, John.
Thank you, Chair. Can everybody hear me okay?
We can't see you though, Sandy. Oh, we can now.
Oh, you can. Excellent. Well, the purpose of this report is to give an overview of the current position in care homes in Leicestershire and some of the support that's being offered by County Council to those homes. And it builds on previous work that's been reported into this committee and on a report that went to Cabinet last week on the social care winter plan. So nationally, for some time, there's been a significant level of concern about the sustainability of care homes. And these risks have really increased quite a lot as a result of COVID-19. And around 20,000 COVID-related deaths have happened nationally in care homes since the beginning of the pandemic. And that's really been subject to a lot of attention nationally. Now, many of those deaths occurred earlier in the pandemic, and in May, the government launched the Infection Control Fund, which gave care homes access to that fund to improve their infection control arrangements, and that's now been extended to March 2021. Now, and I'll say more about the Infection Control Fund later and how it's worked in Leicestershire. In Leicestershire, there are 171 care homes, 86 care homes for older people, and 27 of those are nursing homes. And it's noteworthy that there's a lower proportion of nursing homes in Leicestershire than the national average, and that's really been the case for quite a long time. So we've always had more people in care homes and fewer people in nursing homes. I think probably on balance that's probably a good thing, but it's certainly a feature of the local market. And there were around 50. There are 57 working age adults care homes. Those are generally smaller than the care homes for older people. Typically, there might be a single figure number of people in a care home for working age adults, sometimes as small as 3 or 4 people. In care homes for older people tend to be significantly larger, and especially new homes, very much larger than that. And in terms of COVID, in Leicestershire, there have been 89 confirmed outbreaks of COVID, and the reported COVID-related deaths to the end of August was 166 in Leicestershire. That's quite a difficult number to be absolutely certain of, because the reporting issues are difficult, and clearly not early on, because there was relatively little testing. A lot of that will be based on what doctors assumed was the cause of death. But that gives you an idea roughly of the kind of scale of COVID in care homes in Leicestershire in the course of the pandemic. Now, in terms of kind of what the current issues are in care homes, there are a wide range of kind of current issues. The additional costs of PPE, which are borne by the care home. Increased levels of vacancies are a very significant issue, and those vacancies have been caused by a reduced number of admissions to care homes. The number of people moving into care homes, both who are publicly funded by the council and also self-funders, has reduced. That's partly because I think people want to remain at home, but also I think quite often home is seen now as a safer alternative for people because of the high risks of infection in group living situations. And those lower rates of admission have remained low since the start of the epidemic, and it's likely that pattern is going to continue. So there's going to continue to be a much higher level of vacancies and a resultant lower level of income for care homes. There's also a range of additional overheads other than PPE associated with the pandemic. There's the increased costs of testing associated with that. Particular issue which is emerging now in terms of insurance costs. There isn't a particularly competitive market for insurance for care homes. In fact, there are only really 2 providers of care home insurance. And those providers, as a result of some of the issues from COVID and the liability and the number of deaths, mean that they are either withdrawing from the market and not going to provide insurance cover for our homes, or where they will do, they're significantly increasing the premiums. So that's becoming a real issue in terms of care homes, particularly for smaller care homes, where the actual premium costs can be extremely high as a proportion of their overall costs. There are also a range of issues related to COVID discharges into care homes, which have been widely publicised, and I'll say a bit more about that later, about how that's going to change over time. And just finally, in relation to working age adults, the working age adults homes have been relatively little affected by COVID outbreaks. That's partly because they're much smaller homes with much smaller staff teams, and very often the individuals are not as vulnerable to COVID infection. But really, as part of their work, which has been outlined earlier in the TOM, we are looking to move people out of residential care into supported living, which means that we're moving a significant proportion of the people who are resident in care homes into supported living, which clearly then creates vacancies in those homes, and there will have to be some rationalisation of those care homes because they can't really function. There's not new admissions and people are leaving. The occupancy levels are reducing, but that's not COVID related. That's more around a wider strategy around reducing the numbers of younger adults who live in care homes. Just moving on to some of the council support that's provided. So the winter plan, which was circulated last week to members of the committee, outlines a range of measures that we're taking to support all providers, including care homes. And say members of the committee have already had the opportunity to comment on that, but I'm happy to take any comments on that later. We've also very much increased the levels of engagement with providers, with care homes via weekly calls, which is an open invitation to all providers to be part of those, and also regular weekly ring-arounds of all care homes. So there's a general invitation to engage in a conversation about current issues and support from the council, and then there's an individual conversation which takes place with all care homes where we contact them and ask them a range of questions, and also follow up any concerns that they have. The council, during the pandemic, used its Inspire to Care team to act as a recruitment agency for care providers, including care homes, and that resulted in us being able to recruit more than 50 staff who were able to take up paid employment in the care sector. So these are staff who wouldn't really have been attracted in any other way into that. So that's been really positive. There's also support from the council through the Public Health Infection and Prevention Control team, who are a team who are dedicated to working with care homes to support them, to provide support and training in infection control. And I think they've been very successful in helping homes to improve the level of infection control, and certainly the level of outbreaks within care homes has reduced significantly as a result of that work. The council's also a source of being able to provide emergency PPE through the local resilience forum. So where providers have not been able to source stock in time through the LRF, the council's been able to get emergency supplies for people. I'd have to say that's been used very infrequently, because homes are really much now more successful in being able to source that PPE, but it is still there as a facility. In addition to that, there's been significant additional financial support that the council's provided. That will include from April to September an additional £25 per week for council-funded care placements. There's the Infection Control Fund, which has been administered through the council, even though it's central government money. The council has ensured that that was distributed to care homes. Also, to improve cash flow early on within the pandemic, the council provided a forward payment so that care which had always been paid for 2 weeks in advance and 2 weeks in arrears, effectively an additional 2-week forward payment was made to ease any cash flow issues. The council is now looking at how that can be returned, and we're again looking at how that can be done in a phased way so as again not to cause cash flow problems to providers. We've also got the ability to look at providers who faced exceptional costs, particularly in relation to PPE. Again, that's not been required very often, but if providers have had particular issues where they've incurred additional exceptional costs related to outbreaks, the council can look at those on a case-by-case basis. In terms of, I mentioned earlier on the issues around COVID positive admissions. There's been a lot of concern expressed nationally about the impact that discharging people from hospital who've had COVID or who still have COVID into care homes is a risk to other residents and staff within care homes. In order to address that, the government is now moving towards having a process for discharging COVID positive patients only to what are described as designated settings. A designated setting is one where it's able to provide the kinds of levels of isolation and protection and cohorting of individuals, keeping them separate from other residents. And we're currently working with a range of providers so that we've got a number of designated settings in Leicestershire that will be able to receive patients. Now, the numbers of people who discharge COVID positive in the last few months has been very small because there have been relatively few patients, but clearly that's going to become more of an issue as the number of people admitted to hospital with COVID increases. In terms of other support the council's offering, there's a range of things which we're doing as part of the business as usual of our contracts and quality team, and there's been previous reports to this committee about the work of the quality team, but just to go over some of that. We're offering support with assisting with care planning. We know care planning is a really important part of ensuring that individuals receive the care they need. Everyone needs to have an individual care plan that reflects their needs. And there need to be systems in place to ensure that everyone knows about that and everyone's delivering the care in line with that. So we offer specific support to assist with that. The administration and support of medication we know is really important. And quite a lot of the quality concerns in homes relate to failures that can take place and how medication is managed. Again, we offer particular support and advice around ways of managing medication. Also, there's a specific part of the quality team that focus on falls and initiatives to reduce falls. One of the main reasons that people get ill in care homes and need to go into hospital as a result of fall, and actually working with staff to reduce falls is really important. And another major area is around positive behavioural support, which is a way of working with people who are more challenging and managing those people more appropriately within the home environment. They're also working very closely with the infection control team that I've mentioned earlier and identifying homes and making sure that infection control are targeting the homes that need the most support. In terms of longer term support for the care home market, because a lot of the issues around sustainability have been exacerbated by the pandemic, but the longer term issues within the care home market are more structural and require a longer term approach. So last year, the council implemented a new and increased range of fees that we pay for care homes as a result of a strategic review of care home fees, and resulted in a significant increase in the amount of fees that the council pays for council funded care. And the council is committed to ensuring that over time the value of those fees is maintained by uplifting them in line with the actual costs of providing that care. We've been working in partnership with the sector and listening to their concerns, and in particular working with MCare, which is the representative body in Leicestershire member organisation, working very closely with them. Our Inspire to Care project is very much supporting the workforce, helping to develop career pathways and supporting employers with recruitment and retention. And it's the workforce is absolutely key to maintaining quality of service and sustainability. The quality of local leadership and of the staff within the home are by far the biggest impacts that have on the experience of the residents and the quality of service they receive. And having a stable workforce and stable local leadership will remain absolutely critical to the quality of care that's delivered. Just moving on to the self-assessment that John mentioned previously. So this has already been submitted to the Department of Health and Social Care, as was required. And it asks us to assess the risks to service continuity from now until the end of March 2021 and the mitigations that the Council will put in place to manage those risks. So the version that's been circulated was a draft version, but it's the same as the version that was submitted, although there is some text which is not within this version, but the actual assessment is the same. Now, I think what I'd like to highlight in terms of the definitions used within the self-assessment, I think they quite deliberately understate, I think, the level of risk, because in order to be extremely concerned about the quality of about the sustainability market, you have to think it's going to actually reach a crisis point and widespread service failure within the next few weeks, and we don't think that. But in order to be somewhat concerned, and somewhat concerned to me doesn't sound like a high level of concern, but of the definition within this, it means to expect serious challenges which may compromise our ability to ensure the continuity of care between now and the end of March. So it actually says we actually think there's a high likelihood that there will be significant service continuities issues before March. That's what somewhat concerned means, and we are somewhat concerned about the residential care for older people. Because section 1 of the self-assessment outlines the risks of reaching a crisis point between now and the end of March and the issues which are likely to lead to that crisis. So all areas of the care market have risk, but amongst the highest risks in Leicestershire are care homes for older people. Now the longer term risks are not assessed in the self-assessment, but the likelihood that those significant levels of risks will continue in the medium term. So this isn't a winter issue, it isn't a COVID issue, these are longer term structural risks. Section 2 of the self-assessment outlines the mitigations put in place. Many of these mitigations, as I said, are outlined in the winter plan. And during the COVID period, particularly the council's really worked hard to engage with providers and has improved its market intelligence and has offered providers financial support. And section 3 of the self-assessment outlines the level of confidence we have in the mitigations we put in place. And financial instability is the greatest area of concern that we have within this assessment. And financial instability can have a range of impacts on service quality, the ability of the services to function, staff retention, and ultimately can lead to provider failure, i.e. the service going out of business and ceasing to exist. And Appendix B of the report outlines some of the potential options for intervening in the event of provider failure. Now, the range of options have to be flexible because provider failure can be very different in terms of the kinds of services they are, the size of them, and the specialist nature of them. The range of options would include either direct intervention by council, either council taking on the control of the service, commissioning additional support through a provider of last resort, or commissioning additional support in more the normal way. So really, that's all I was going to say there, but I'm happy to take any questions.
Thanks for that, Sandy. We're going first to Mrs. Broadley.
Thank you, Chair. Given the last report that we've just had and said was an excellent report, it's the fact that the vacancy rates are going to increase in the future is acceptable if we're going to obviously look at people remaining independent. I've got 3 questions actually, but before I answer, I'd like to say that I think that the council and the officers and the staff are to be congratulated on the way that they've coped with the COVID issue, especially in adults social care. I think it's been exceptional, and I think that our thanks need to go to all the staff for their hard work. But I want to say that you said about a lot of support that the council has offered to these care homes, given the current crisis. What percentage have taken up the council's offer? Because I would like to think that a lot of them have, given some of them are struggling. Another question is, do we look at the CQC reports before we place people into these homes, given the problems that we've had with Leicestershire County Care? And is there a forward plan should the capacity become a problem in the future? Thank you.
Thank you, Chair. In terms of a percentage taking up the council's offer, I suppose the council's offer isn't one thing, so I think it's difficult to turn that into a percentage. But what I'd say is most homes are really keen to engage generally, but it's really going to depend on what the situation of the home is. So homes who take very few council placements are likely to have less engagement than homes where the council does place people. Homes that have got higher levels of vacancies may be keen to engage than others. But generally speaking, I think most homes have been very keen to talk to the council. We've had good participation in the calls. And it's really been a very positive period. And I think our kind of relationship with the care homes kind of paradoxically has kind of never been closer. So I think in some ways, it's definitely better, and I think there's better communications between us now than the homes, and I think there's probably ever been. But I say it'd be very difficult to give you a percentage on that number. In terms of CQC reports, yes, we do look at them, but I think you have to look at them in context. So if a home is rated good, there's be quite a long period between inspections. So you do need to look at a wider range of intelligence, because one of the things that I think we know is that homes can very quickly deteriorate, and they can very quickly improve. And so we rely, I think, on a wider range of intelligence than just the CQC reports. And indeed, if we've got concerns about homes, we're very often the people that will tell CQC their issues, which will then make the CQC more likely to re-inspect those homes. But also the same, we will provide intelligence where homes are making improvements. But yes, of course, we would be mindful of CQC's rating when placements were made. And those are publicly available reports again, so we'd expect that families would also want to look at those reports themselves. And I've forgotten you. Did you have another question, or have I covered them all?
No, it was asking about the future, having a future plan for capacity should it be needed, given the state of some of the care homes.
Yeah, well, I think overall, I don't think we're expecting that there'll be more care home capacity required in the short term, because there are a significant number of vacancies. So if and there probably needs to be some rationalisation of the market if we're going to carry on with a high level of vacancy. So we are talking to homes with high levels of vacancies about what their plan is, because if a home has got 30 or 40% vacancies, they need to either operate in a different way so that can be sustainable, or they have to be looking at a plan to rationalise their business or exit the market. So we are having a number of discussions with providers about what their plan is about dealing with the level of vacancies that they have. As I think as I outlined previously, it's our strategy is to support people at home rather than to support them in care homes. So a lot of the work we're doing is to improve community services so that fewer people go into care homes. But we are very much talking to providers about what the future, longer term future is for them, and where people are looking at building new homes, because it's not up to the council to determine whether a new operator can come into the area. That's a decision that they make independently. We would certainly advise them of a longer term strategy, but it's likely that a lot of that new build will be replacement facility rather than new capacity, because we do need to have more modern and more efficient care homes for those that are going to require that kind of care in the future.
Thank you, Sandy. Mrs. Wright.
Good afternoon, Sandy. I think actually you've captured quite a lot of what I was actually going to say in your answers to Mrs. Broadley's questions. But first of all, I'd like to say and echo and say thank you very much for a really comprehensive report. Really detailed and really good reading. And also, again, to congratulate you and your team and everybody for the support they've given the care homes during this, very predestinated, can't say it, during these times. Anyway, one of the things I was going to say that given the increase in temporary admissions, isn't it likely going forward that this is going to be the given trend with hospital discharges changing the pattern and going to the pattern they are doing? So my question was around what is the strategy going forward, knowing that this trend is coming, and also coupled with, the 30% of residential care people could be helped at home and the 17% that you've actually achieved. So that was my first question, which I do feel you've probably answered to some degree. The second question, if I may, Chair, was about the number of homes. We said we had about 171, I think, if I was correct. And it was just how they were made up. Are they part of a large group? So if one group collapsed, would that leave us very vulnerable here in Leicestershire? Or are they made up of several independent homes, so the risk is spread? Thank you, Sandy.
Thank you for that, Chair. In terms of temporary admissions, I think in some ways that's been a kind of product of the kind of circumstances that we're in. I don't think it is an ideal situation. I think the strategy is very much about home first. So the plan should be to get people home as quickly as possible and returned home with exactly the kind of support that they need. And in some ways, admitting people to home temporarily, into a care home temporarily before they return home is very often not ideal, because it would be better if they could have gone straight home with the care they need. That would have been better. I think the other thing that probably is part of the longer term future is a more coherent approach to discharge to assess, so that we can admit people to more specialist care home that's only there to provide short-term care to get people home. Because I think a lot of those temporary admissions have effectively been admitting people into what's a long-term care home for a short period, and that isn't ideal. It'd be much better to have a more special facility whose aim was solely to provide very short-term care and therapy and support, so those individuals can then get back home as soon as they can. And that's part of an overall strategy of getting as many people at home and as few people in residential care as there need to be. In terms of how the homes are made up, well, it's a very diverse market. So nationally, there are some very large providers. But interestingly, those very large national providers actually have a very limited presence in Leicestershire. So the very big providers like Four Seasons and HC1, they do operate in Leicestershire, but they are not by any means the dominant suppliers. What we have a number of larger regional providers who are in the kind of 20 to 50 kind of home range, and they're kind of big players locally, but they're not big players nationally. And clearly, if any of those providers got into significant difficulty, that would be quite a real issue for us, and the council wouldn't have the staff to intervene in those kind of situations. We definitely haven't to be looking to other providers to help assist with that. But there are also a significant number of much smaller operators, people maybe who have 1 to 5 homes, and there's a significant number of those. And if any of those were to fail, that would be much more manageable, because there is quite a bit of capacity, spare capacity, to move people. So if a single operator, if a 30-bedded home failed, we probably would relatively easily be able to relocate all those people to alternative homes. And hope that kind of covers what you needed.
Yes, thank you, Sandy.
Thank you, Sandy. Mr. Harrison. You there, Dan? You're still muted. You're still on mute, Dan. I think the technology might be catching up with us.
Yeah, I think he's frozen.
Yeah, I think he has. Do I have any other members wish to ask a question?
I just had a quick question.
Right, Ms. Mayor, yep.
Yeah, just on the care homes, the money that we've given them, how likely is it that we will get that money back, or is there some difficulty in getting that? Because that paragraph read like that.
Chair, if I could just clarify which money we're talking about here. We're talking about the forward payment.
Yes, the forward payment.
Yeah, well, the forward payment, I mean, is where we've paid for advanced care, and what we said was that when we made that forward payment, that we wouldn't reclaim it before September. So we're now in discussions with all providers. This isn't just for care homes. This is for also for other providers. That's what care homes are the largest amount financially. So there are individual discussions taking place with the providers. The great majority of care homes have indicated that they will pay it back, and they've agreed how they'll pay it back, whether they'll pay it back in one lot or in a number of staged payments. So I think we know there are risks associated with it, but the great majority of care homes have indicated that they will return that, and we are going to continue to have a business relationship with all those homes. So we are going to continue to make placements and have a financial relationship with them in the long term. So I think it's in their interest and the council's interest that we're working together, and we're not involved in any kind of difficult financial dispute.
Thank you for that, Sandy. I think Dan's still frozen, so I think we'll have to.
Can you hear me, Chairman?
I can hear you. You're still frozen, but we can hear you.
Okay, well, we'll cope with the technology the best we can, if I may. Well, I'd like to start off with everybody else, Sandy, saying first class report, love the delivery, very succinct, excellent. But it is a very serious item we're talking about. When I look at the 86 adult residential homes, and obviously we're beginning to start fishing in that area. We're not going to have a massive effect, but it will start to have an effect as we move people from residential into more independent living, which is going to be an amazing thing for us to be able to do and for them. But it will have an effect. The 27 nursing homes, I put them down most at risk. I've actually run and owned a nursing home, so I know exactly the background to it, not in recent years, but it is serious, and it's what we call heavy work, heavy nursing. It's not residential, where they're ambulant and people can walk around, maybe with an aid of a stick. These are people who need mechanical or physical help to move. These are people who may be suffering from 2 or 3 up to half a dozen different serious complaints. So it is a total different style. You'd have a senior nurse, a person who would be of a high caliber. This sort of person talks to doctors regular, daily, talking about patients. Okay, it's a really, really tough and expensive thing to run. And I feel that regardless of whatever we hope or do, I think there is this sort of downward trend upon how it's going to be looking, mainly for residential, I'd have thought. But the nursing, because of the figures and the administrator's first responsibility would be to that home, the people there, so it wouldn't be an overnight thing that, clothes went on the door and that was the end of it. So there would be an element of sustainability about it. But I do think ultimately, and it's a personal view, that we will see a gradual trend, I feel, down on occupancies. And if that is to maintain, then that will start to create a problem. Thank you, Sandy. Thank you, Mr. Chairman.
Thank you, Dan. I think that was more a statement than a question. So we'll let Sandy off that one, unless Sandy wants to respond.
Well, just on one point, really, on the working age adults. So I think there, I suppose these aren't plans. I mean, this is actually happening, as Councillor Ratcliffe said. She's actually seen people move, and a significant number of people have now moved out of care homes into supported living, and it is having an impact now, and a very positive impact. But there clearly is an issue about the stability of the care homes that are, the people have moved out from. But that is really quite an advanced state of delivery we're at in terms of those people moving out of those care homes.
Thanks, Sandy. In the pre-meeting with chair and spokespersons, we recognise this will be an ongoing discussion. John has committed to potentially coming back to this committee in March with a further update once the COVID situation becomes clearer. I mean, we recognise it's a fluid situation, so it might have to be to June. And ongoing, I think it's clear that our officers are carefully monitoring the situation and will keep this committee informed, particularly in case we have to look at other avenues of going forward. But like everybody, I thank the officers for the report. It's one we asked for, and I think it's very valuable for us as a committee to know. And I think, to be honest, if I was a member of the public watching this, I think I feel reassured that our officers are on top of the situation and are keeping the situation under close monitoring. I think would give confidence, I hope, to all those who've either got relatives in care homes or are at the stage when they may have to consider relatives going into care homes. So thank you for that, Sandy. We'll now move on to agenda item 10, which is the technology-enabled care, which is set out on pages 99 to 122. We're going to have a PowerPoint presentation first from Nigel Thomas. So let us hope I get to see this one this time, see if technology comes to me. And then we'll move on afterwards once the presentation has taken place. Over to you, please, Nigel.
Thank you, Chair, and good afternoon, everybody. I'm just going to share my slides. If you just say when you can see them.
Oh, I've actually got this one, so I'm quite excited. Thank you, Nigel.
Hurrah. Okay. So thanks for inviting us to come along to share this. We wanted to share with you the outcome of a diagnostic piece of work on care technology, which we undertook with Hampshire County Council, who have done a lot of pathfinding in how social care services can make the best use of customer-facing care technology. Now, I say customer-facing, what I mean by that is technology that is actually that people can use in the home, and it covers a wide continuum of things. It could be something as simple as a large talking clock that can enable people to hear the time, but it can go through to much more sophisticated monitoring equipment that could alert a carer or a family member of the activity of their relative if they're living at home. But the main outcome of this is to enable people to, where possible, continue to live independently at home. And what I'm going to do, this is the executive summary of the report, which is attached as an appendix to your report. And I'm just going to pick out a number of the key slides on this. So for a while now, we've been aware that perhaps care technology or technology-enabled care is something that perhaps we could be utilising and making better use of. And through a range of sort of attending conferences and what have you, we'd been aware of Hampshire's work. So we invited them to undertake a high-level piece of diagnostic work. What we wanted to understand from this work is if there was an opportunity to transform an area of our work that could deliver results and be future-proofed, but also find out whether there's any financial case for transforming our approach to care technology. We do have an approach, but I think as the report will highlight, it's probably a very traditional one, and it doesn't put tech at the centre of trying to assist with people's outcomes. So Hampshire, as we said, did a piece of diagnostic work with us. They have a technology partner as part of their authority, PA Consulting, and so through Hampshire as well, we were introduced to them. The main conclusion from this piece of work is that there is a case for transforming our approach to care. Hampshire undertook a range of work with us. They looked at our existing provision. They undertook some focus work group with our staff and stakeholders, and they undertook a survey to gather, sort of information and intelligence to enable them to come to this conclusion. And what they concluded was that our current approach it does exist and it does deliver good work, but it is fragmented, and that sort of in order for us to make steps in the future, we really needed to look at a new service model to put care technology at the centre of assessments of people and what their outcomes might be. There is work that we can begin to do immediately, really, in terms of taking us on that journey. This slide just really looks at what our current approach is. So on the left-hand side, we may have somebody that's been identified by a care practitioner of benefiting from care technology. But establishing the eligibility for each type of service can be unclear and confusing in our pathway. But what we have to refer people into is an in-house assistive technology team that provides care technology equipment, but they don't provide any monitoring services. And we also have a route into 5 of the 7 district council services that operate a very traditional lifeline service, a pendant that alerts responders to falls and so forth. But that offer, again, is quite fragmented across each authority. In some, it's quite mature. In others, it's more basic. This slide really just looks at, if you look at the key, which parts are part of our current practice in terms of service delivery and service transformation. And you can see that across a range of things, from referral to triage to how we deal with repair and collection, it is partially part of our approach, but it's not fully integrated into the way that we deliver an end-to-end service. And there are a number of areas there with the Red Cross where it's not part of our current approach. So we don't, for example, have a monitoring service. We need to do some more work in how we govern our approach to technology. And there's little service development in terms of keeping abreast of what changes there are. The report makes the point that there's a range of commitments and investments that we need to consider in order to take such a service and a model forward. And I think one of the things that is really important to pick out of this is the fact that we're really talking about an outcomes-based model. So it's not really about delivering tech for tech's sake. It really does have to meet the outcomes of somebody that's been assessed by a practitioner. But we need to have a very clear vision and a strategy and a business case. And we need to make very clear what our commissioning intentions might be if we were to progress further with this, and also have a way of measuring the financial and non-financial benefits of that care technology, and have a clear line of accountability and governance associated with it. This slide really just looks at features of what the council should consider. I'm not going to go through these other than just to reiterate the fact that this one, the third one here, it should be outcomes focused, not equipment led. So it's not tech for tech's sake. This is just a summary of some of the survey results that they had with our staff. So on the green areas are the positive things that sort of staff feel about the use of care technology, and on the other side, the red is perhaps more of the challenges and barriers that we may face. The fact that our service is perceived as very traditional, hasn't changed much over time. People aren't necessarily up to date on what technology changes are available. Eligibility criteria and costs are not clear. The next thing that they looked at was really, is there any financial benefit to be had? Are there any opportunities for us to realise financial and outcome benefits? And the next couple of slides really proposes that there are. So this graph really says that if we were to support over a 5-year period around 3,500 users, at the end of 5 years, there'd be a cumulative incremental net benefit of around 5.4 million with a return on investment of 90% over 5 years. And that's assuming incremental costs here of around 2 million. So you'd have 8 million, you'd invest around 2, and then your net benefit would be 5. This slide looks at, well, okay, what if that didn't work? And they looked at a number of scenarios around that option. So that's, as we've just said, that we're supporting 5,500 users. At the end of year 5, we'd be looking to generate a net benefit of 5.4 million. If we didn't have that amount of users, if, say, we supported just over 2,000 users, it would still show a net benefit of 4 million. But if we had a reduced benefit, so if we were supporting 5,500 users, but the benefits coming out of that support wasn't as high as in that first scenario, then there'd be still a net benefit of around 3.3 million. And the last option, if there were reduced growth and reduced benefits, so we were supporting just over 2,000 users, and it wasn't generating the benefit, there's still a net benefit there of 2.5 million. Now, clearly, some of this work, this is a high-level review. We do need to do some more work on that, but it did leave us with the feel that there is a very solid case for looking at this in more depth, so they can be very clear about how we take this forward. So there are a number of options as to how we could deliver this in the future. We could take an option, and this is what the report is proposing, that we commission a county-wide transformational approach following a more detailed business case. We could look at developing the existing AT service, or we could develop a hybrid model. But I think we felt from a departmental perspective, this is quite an important area that we need to be making strides with fast, and to really look at that option of a county-wide transformation approach is our preferred way forward. This slide really talks about how we might approach that in terms of commissioning. We could commission a partner, as Hampshire have done, to come in and work with us, sit within the department and do a lot of the heavy lifting, if you like, in terms of that work, in which case we would go through either a procurement pathway, or there is an option which we could explore to deal direct with Hampshire County Council, because they have this as part of their sold services in a local authority joint working arrangement. We could have another model which said that, okay, we might not have a partner, but then that would mean that we would need to follow a commissioning pathway, or we could actually do nothing and continue with the existing service. I think the department felt very strongly that that wasn't an option for us, given the opportunities that this high-level diagnostic presents us with. This slide really just outlines some of these short-term opportunities that we could implement over the next period of time, work around developing a vision and strategy, looking at the design of what that future service model might be, so that it can be built into the business plan. And this slide really just gives a flavour of what we have today and what the future service might look like. So I'm not going to dwell in too much detail about that. And these next two slides really are just some case studies based on Hampshire's work with other authorities that they've worked with. This is one around looking at simple adaptations or purchases in the home that can help increase sense of well-being, but also reduce calls into, in this case, a monitoring centre. And this area is around helping people manage long-term conditions and return to work. This person, and these are real cases, this person was at work, but had domiciliary care of 3 to 7 hours a week. But by using a technological solution to what their issue was, they were able to reduce that amount of domiciliary care going in, but also leave that person feeling that they could, in this case, manage a case of epilepsy and continue their work as a frontline NHS worker. So in short, that really is the report. What the next steps with this are to develop a business case, a fuller business case, which would be presented to Cabinet in January. So happy to take any questions.
Thank you, Nigel. If you want to return us back to normal.
I'm trying to do that. Yeah.
Right, thank you, Nigel. First off, it's Mrs. Wright. You're on mute, Maggie.
I think you're still on mute.
Sorry, I was thrown completely out of the system then. Sorry.
I can hear you now.
Unfortunately. Sorry. Thank you, Nigel, for the presentation. I appreciate this is the starting point of the modelling and the business case going forward, but I'm just curious how it'll fit in with other existing models that are already out there. I'm thinking probably of the light bulb project, disabled facilities projects, the Alzheimer's Society, for example, who do a lot of aids and adaptations at the moment. I'm just curious how it'll be working with those partners going forward.
Yeah, thanks for that. Part of it will be, obviously, we'll need to do some engagement with stakeholders, some wider engagement with stakeholders to set out our direction, but also give them the opportunity to comment and pick up on any areas that they wanted to talk through. District councils, for example, I'm sure will be interested to listen to this approach because they have, they have a range of responses to what is at the moment I guess quite a traditional method of supporting people. This method, I think, this model is much more holistic. It's not dependent on particular projects. The way that Hampshire work with their partner is that they sit within their department as a broker. So if the outcomes indicate that there might be a tech solution to a particular outcome that somebody's wanting to look at, they will then source the appropriate solution. Now, that might be actually referring people to stuff that's already there, stuff that's already existing. It might be a completely different, solution.
Thank you.
Mrs. Broadley, please.
Thank you, Chair. I'm presuming that when we're talking about this, we're not just talking about the lifeline, if that's what it's called, where they have the alarm to go off if they have a fall or whatever. I'm presuming, given the report that we're talking about, you mentioned speaking clock and things like that. There has to be the training, obviously, for the user, and there have to be capable of doing it. I mentioned earlier my 90-year-old mother, who we bought a Alexa for Christmas last year. She hasn't got a clue. It sits there. She talks and it'll say something back to her, and she said, I haven't asked it a question. You know, it totally throws her. So whatever's put in place, I think that it's important for the user to feel comfortable with it, but also the monitoring and by whom. If we're relying on family members to monitor this, you know, it goes to them if something happens, then they also need the full training on it. I'm not saying it's not a bad thing. I think it's anything that helps keep people independent is a good thing. But we've also got to take into account the cost to the user. If people at the moment are having home care go in, if we're going to put technology in that doesn't require home care to go in, it needs to be parable, you know, the cost, or, you know, preferably cheaper. So all these things, I presume, will be taken into account. As you say, this is just the start of it.
Yes, that's right. I mean, just to answer the question about this, you're quite right. This isn't just around lifelines. This is about, you know, sort of, there's a whole range of, you know, sort of technological aids, not all of which, you know, are associated with social care. You know, you mentioned the Amazon, you know, sort of Alexa tool, you know, sort of that, you know, sort of that can be utilized. But of course, it does have to meet the outcomes of the person. I don't think we're suggesting here that we're replacing, you know, sort of traditional stuff, but it's really about taking the opportunities to place tech far more front and centre in terms of what those solutions are. We know from talking to Hampshire and their experience, a lot of their financial benefits is avoided cost. So, you know, sort of that avoided cost can either be, you know, cashable saving, or it can be by utilising those resources elsewhere, you know, sort of to do different things. But it does need to take into account, you know, sort of people's appetite and willingness, and it's not going to be an answer for everybody. You know, sort of we're not, you know, sort of with, you know, sort of the work that they've done is looking at, you know, over 5 years reaching about 3,500, supporting 3,500, you know, sort of service users with a solution of one kind or another. So looking at the monitoring side of the system, you know, it might be that our model, what we want to take forward, isn't, you know, we don't have that sort of monitoring. It might not be something that we would want to do. So again, you know, sort of we'd need to take account of that. But certainly we are talking about, you know, a level of cultural change, not only sort of in terms of possibly working with a partner, but also supporting staff so that they've got that increased knowledge, so that they're better equipped to make a decision when they're assessing people's needs.
Well, that is good, because I would hate to think that you get some people who are totally alone, and somebody coming into them so many times a day is possibly the only company that they get. And it's not the same talking to a machine. So I'll be interested to see how it goes forward. Thank you.
Thank you.
Mr. Poland.
Thank you very much. And can I just start by saying it'd be great if we could have a dog at every meeting, Richard. It looks fantastic. So, and the cat too, Christine. My question on a serious point here, though, is this technology, for want of a better description, more of a philosophy of ways to do things in the future, or is this sort of envisaging bringing in certain specific pieces of technology? The reason I asked the question is because technology is an increasingly important part of everyone's life. What we have today will be out of date next year, 2 years from now. And if we sort of made it a sort of a moment in time that might be out of date in 12 months, 24 months, or is it really more something that's sort of an ongoing thing? So as new technology comes in, we look at how that can be adapted and how that can be used in effect. But yeah, as I say, I think that as technology is such an important part of everyone's life. The fact we have an online meeting right now is an example of that. So I think that, yeah, it's the future, most definitely. But I just wanted to get that sort of background, if that's okay.
Yeah, I think you're right. It is more of a philosophy. It's not about committing to certain types of tech now. The reason why, sort of, I think Hampshire have been so successful is they're not tied into particular products which they have to use. It is tech agnostic, so sort of that tech is going to change over time. Hampshire have been doing some really interesting work with assisted artificial intelligence and robotics, for example, which they're beginning to share with the sector. So sort of the value of an option where we had a partner that this is their bread and butter work, but that aren't tied to particular products, means that they can to keep abreast of those changes and make sure that horizon scanning informs our direction, and so that enables us to be flexible over time.
Thank you, Mr. Poland. I've got no more hands up. I think from comments, Nigel, it's clear that I think the committee are very supportive of developing the business case on this one, and people shout at me if they disagree, and we would recommend urging Cabinet to support looking at that business case and coming forward. I think, if we go back to the very first report today, it's clear that we took a step into the unknown, and it's proved successful. And I think this actually could be a further step into the unknown, which could prove just as successful if we went that route. And it's taking Tom out to the wider community even further. So I think we would support that, and we would look forward as a committee, I'm sure, to being kept up to date with development should Cabinet decide to go ahead with this and commission that. And I suppose just on a personal view, I think if we have a council that's an expert in this, it would seem strange to me not to use them and perhaps to go out commissioning when we've got someone there. But that's something to look at as we go down the process. So thank you very much for that, Nigel. We're now moving on to the final agenda item, which is Community Connections Programme, which is on pages 123 to 130. And I suspect, Nigel, you're getting no break because John's been very quiet, so I suspect it's coming back to you.
Yes, I think it is. This is just to give the committee an update on the work that's taking place within the Communities and Wellbeing Service of the department, as you know, libraries, heritage and adult learning. And it's really a piece of work that is looking at how we address more effectively community assets that exist in communities, not just libraries and heritage, but sort of clearly our volunteer workforce, some of whom sort of manage our libraries, but sort of do other things as well. So just to give a background to this, the department or the service restructured earlier on in the year, and part of its establishment was to create a participation team, and this became operational in July. And the work of this participation team was to really make sure that the community assets or the resources that the service has are strategically positioned to help contribute to the departmental aims and outcomes, particularly around health and well-being that are outlined in the departmental strategy. So we were lucky that the Improve Better Care Fund enabled to lever in some money which doubled the size of that team. And this happened obviously before COVID. But since that restructuring completed during the lockdown period, the team became established. They have been progressing, albeit sort of with a totally different landscape to what we were anticipating. And I would urge members just to have a look at the appendix, which is the note and a bulletin on some of the areas of work. So this team really is following 3 linked strands of work. The first is looking at how we can continue to support community capacity across our area, particularly through building that capacity through community managed libraries and independent museums, as you know, themselves are being managed by trustees of volunteers. So this area of work will look at developing seed funding Pathfinder projects with groups like CMLs. And the aim is to have programs, wide range of activities, participative arts, as well as trying to build those organisations up so that they are sustainable and future-proofed going forward. The networks will look to develop their own cultural programs. So this isn't about going into a community and saying, well, we think this is what would be a really good idea to do. It's very much, the principles of this work is very much based around co-production and getting that feedback and direction from local communities, and then having a team of workers that can help seed fund or support that to happen, so that it's not reliant on officer time over time. The second strand is around doing work in local communities, which is themed and time limited, and identifying target audiences. So, for example, people that might be at risk of social exclusion, people that are perhaps isolated from their local community, or in one particular area, our response to the Black Lives Matter movement. So this really is looking at specifying targeted groups and have a developing activity that encourages underrepresented groups and individuals to make use of our cultural assets. And the appendix, if you do get a chance to have a look, do have a look, because there's a couple of examples there that are already there and online. The first is a project called Do You See What I See, which is people interpreting elements of our collections in a way that actually resonates with themselves. And some of those people are from BAME communities, and I would urge people to have a look at that work, which is available online. And then there is a Black Lives Matter 2 project that's recently been launched, and again that is comprised of practitioners reflecting on what that means for how they interpret their work. But also we've got community representation in terms of what that means for them. And there are a whole range, if you do visit the website, there are a whole range of little video clips which really tell the story much better than can be presented in a report. So do go and have a look at those and explore them. And then the third strand is looking at continuing to develop our volunteer offer. So an example of that is, and again, is in the appendix, the 1485 Around the World project, which is led by 50 volunteers from our Adult Learning Skills for Life courses, but linking them in with staff at Bosworth Battlefield to explore what was happening across the globe during the time of 1485 and the Richard III area. So that is there, and the another area is looking at extending our home library service, so that it isn't necessarily just about delivering books, which obviously lies at its heart, but really looking at more of a virtual cultural service, a home cultural service, where through technology we can live stream library events, shared reading groups, and put people in contact with material that they can explore online, whilst we're living in a time where we can't actually bring people together physically. Obviously, when we were planning this, it was very much designed to go into communities and work with those communities at their bases. We're restricted to what we can do in that area, so the team have had to really adapt quite quickly, and all credit to them in terms of what they've put available for people to engage with online. So really that's just an outline and an update of the work of that. It fits very squarely into other work that's happening across the council in terms of how we utilise community assets across the piece, and we're hoping that sort of it will develop positively over the next year. Happy to take questions.
Thank you, Nigel. Mrs. Radford.
Sorry about that. I started speaking before I put my microphone on. Can I just ask, Nigel, you keep saying about going, sorry, I'm coming back to myself, about going online and looking at this. For the benefit of people that might listen into Scrutiny and what have you, can you let them know how they find that information out that we've got on our mod.gov and everything?
Yes, if and if I'm just looking it up on my phone now, there is a participation website which outlines all of this work and guides you to all of those things. If people go to www.communitycurators, all one word, .co.uk, it's all outlined there. So that's communitycurators.co.uk. It's all set out there.
Thank you.
Thank you, Nigel. Mrs. Wright.
Thank you. I just couldn't miss the opportunity to say how brilliant the bulletin and everything is. I've been reading it and I think the projects and everything are so exciting, and just say well done to the team. So well done, Nigel, and thank you.
Thank you.
Thanks, Maggie. I said we certainly note the work done by the team, and massively supportive of what they're doing, and thank them for everything they're doing. And it says the committee is also invited to comment on the greater role of the service in supporting. I think, we are fully supportive of what they're doing. I think our comments would be, this is work that we as a committee will want to see being done. We recognise that there will always be issues of obtaining finance to do this. But we think it's better to strive and try and then almost worry about the money afterwards than not to try. So we think on some of these things, if you start it and you're working on it, the money will follow at some point. So I think that would be the comments, unless anyone dissents from that view going forward. There are no other hands raised, so I think that's the final report. I think I would just comment, and hopefully there are some members of the public watching, that we are going through extraordinarily difficult times with COVID-19. But what I think we have seen today is a council that is, working through that and providing support. But more than that, we're looking here at reports which are ongoing, which are non-COVID specific, which will make the lives of our residents better going forward. So I think it gives an illustration that your county council is not only shut for an ordinary business because of COVID, it is still continuing to work and support other areas and work on greater projects that will support residents going forward. So I think that's massively positive, and it's nice to come to a meeting which is really forward looking today about what we can do and where we are going in the future. So I thank all the officers for that, and the portfolio holder and cabinet support again for helping to drive through some of these benefits which we will see and commenting on this committee going forward. So it's only now leaves to say that members have the future meeting dates. The next meeting will be on the 16th of January 2021. There are no urgent items. So could I just thank everybody for their involvement, for the questions raised, and hopefully for members of the public for taking the time to listen in and take note of what the county council is doing. So thank you all, and have a very pleasant evening.
Thank you, Chairman.
Thank you very much, Chairman.
Thank you, Chairman.
Thank you.
Thank you, Chair. Good night.